I was diagnosed with diabetics it's been about 30 years, but since I've been in this place, it's been about a year more or less. And to tell you the truth, I believe that it's been one of the biggest things I ever did, because otherwise, I don't know, God only knows what will happen to me. Right now I feel good, thanks to all these people in here. And to tell you the truth, I think I'm fortunate to be in this place.
Reinaldo Cisneros, he's a very happy. He knows now how to manage their diabetes.
The patients, when they come in, are directly involved in their care from the beginning.
What we've done here at Western Diabetes Institute is challenge the assumption of diabetes care. This is the kind of place that you can come to, spend a day with us, and get everything that you need to have evaluated that is recommended in all the major guidelines for optimal care. We like to think of this as a coherent solution shop for a diagnosis.
On Fridays, we all sit down around the table and we discuss all aspects of their care, from their social needs to their medical needs to their psychological needs.
Graciela and the rest of the people in here, they really help me a lot. When I don't do or I eat something that I'm not supposed to, I feel like I'm disappointing them. This is my own way of thinking.
There are real-world challenges. We need to think of new models. They have to be empowered with knowledge. It has to be about them. So if they have access to their story, what's my condition? We need to be able to capture all that information in a snapshot, if you will, of the patient. How it's affecting your eyes, your kidneys, your heart, your mouth, your lower extremity, your overall functionality. We can essentially provide that comprehensive diagnosis to that patient who walked in merely knowing that they had been diagnosed with diabetes. If we were going to look at a complex condition, we needed to gather all the information about that patient, look at the patient holistically. What's the patient's phenotype, if you will, and are they any different from patient to patient? We needed to create tools that enabled that team to work optimally and function at the highest level. We designed the Diabetes Cross-Disciplinary Index, or DXDI. In a move toward precision-based medicine and personalized medicine, we need to know more about the individual patient.
Diabetes and periodontal disease go together. This particular population base that we deal with has a significant periodontal issue.
Periodontitis is the sixth complication of diabetes. We're dealing with an epidemic of periodontitis. It's an inflammatory condition that will drive long-term consequences and complications: cardiovascular disease, stroke, kidney disease, and premature death. Well, wouldn't you want to take care of that first?
I was in a very bad shape, especially the way I ate. My diabetes went up high, really high. I have changed my habits a lot. Try to do some exercise, especially because they motivate me to do something else. I mean, not to be the way I was before.
You have to deal with the diabetes every single day, 24/7, 24 hours, 7 days a week. It's very hard. So our goal is to help them try to live a better life in a different ways, to really enjoy every single day having diabetes. That's why they have us here as a support team.
The efforts need to be focused on care delivery science and improving how we deliver care to the patient.
Our main goal is to make a plan with them based on the first day when we see the DXDI, the model, the colorful paper.
This institute was built to train the next generation of healthcare workers.
I think that this is actually the role model for the future.
If it can happen in Pomona, it can happen anywhere. We like to think that we're leading the way for the future.
It's amazing, for reals. It's amazing.